Hello, hope you're doing well. This is Dr. Farhangfar. I want to welcome you to week 5 of the 12 weeks Mediterranean weight loss program, The Shift. Today, I will be discussing a very important topic for weight loss. Oftentimes, patients come to me complaining of not being able to lose the weight that they want, despite their best effort, despite exercising, monitoring their dietary intake. However, the weight will just not come off. So when we look into the root cause of the problem, we realize that their sleep is off and that is creating problem with their weight loss efforts. So today I want to talk to you about ways to optimize your sleep in order to enhance your chances of being able to lose the weight effectively. So I want to start with the regular warning. The information I'm presenting to you in this format is for educational purposes only. Please consult your medical advisor to get personalized information about your particular situation. And it's important to get help, to get support, and to get going with your weight loss effort. Okay, today I will be talking about the relationship between sleep and weight. I will be talking about the hormonal regulation of appetite. I will be going over impact of sleep quality on food choices. Then we will be talking about sleep and metabolism, very important topic. And also we'll be discussing practical ways to improve sleep and weight management. Sleep is often overlooked factor in regulating your weight. Sleep is a vital element in weight regulation, affecting hormones, metabolism, and food intake. We also know that too much weight can affect sleep quality as well. So this is a two-way street. Lack of proper sleep can cause weight gain, and excess weight gain can disrupt regular sleep pattern. So it's important to realize the mutual relationship between weight and sleep and how we are able to regulate this. Insufficient sleep disrupts body's weight regulation. Each hour less than 7 hours of sleep raises obesity risk by 9%. And we know that obesity risk of developing sleep apnea increases as your weight goes up. Your chances of getting sleep apnea increases. Sleep apnea is a condition that during the night, due to the collapse of the upper airways, we are not getting enough oxygen. This will cause body to go into stress mode and start making stress hormones such as cortisol, which are detrimental to your weight loss efforts. So it's very important to make sure that you're getting good quality sleep and to make sure that the cortisol hormones are under good control. And we will be talking about this some more in detail later on in this discussion. So let's talk about hormonal regulation and appetite. The main hormones that are involved with regulating sleep are ghrelin, leptin. Sleep deprivation disrupts hormonal regulation of hunger and satiety. Ghrelin is a main hunger hormone, increasing hunger signals to the brain, while leptin is a satiety hormone, decreasing those same signals. In one University of Stanford study, 14.9% rise was seen in ghrelin and 15.5% drops in leptin in those subjects sleeping 5 hours versus those sleeping for 8 hours. This imbalance between ghrelin and leptin leads to increased appetite and reduced fullness feeling, which can increase the quality of weight gain. Okay, now let's talk about metabolism and the interplay between metabolism and sleep. We know that metabolic dysregulation can result from poor sleep habit. Chronic lack of sleep causes insulin resistance and glucose intolerance. So there's two different phenomena that are going on here. There's insulin resistance and then there's glucose intolerance. Insulin resistance is a situation when cells do not respond properly to insulin, so glucose cannot enter the cells effectively. Glucose intolerance, on the other hand, is blood sugar levels rising abnormally after eating, or they can stay elevated for a long period of time. Both of these conditions can result from chronic lack of sleep, and over a long period of time can increase risk of type 2 diabetes and other metabolic disorders. And needless to say that this metabolic shift can hinder effective weight management. So think about metabolism as a finely tuned symphony and is governed by the circadian rhythm, which can regulate your insulin resistance, your appetite, hormones such as ghrelin and leptin, which we talked about earlier, digestive enzyme production, and fat storage and breakdown. When you eat at inconsistent times, especially late at night or skipping meals, you're throwing off this fine-tuned symphony. It is like playing jazz in a classical orchestra. It just does not make sense and can disrupt your metabolism. So let's talk about ways that we can improve sleep. Sleep hygiene and environmental optimizations are very important as far as improving the quality of sleep and being able to lose weight, because that is the bottom line. You want to lose weight and you want to remove the obstacles that are in your ways, preventing you from being able to lose weight. And from my experience, lack of sleep is one of those factors that can adversely affect your ability to be able to lose weight. So it's very important to be able to get help, get support, and to be able to lose the weight that you want. If you have any questions or comments, please make a comment and below so I can reach out to you and be of assistance to you. So maintaining consistent bedtime and awake time is very important in regulating your circadian rhythm. We already discussed how disruption of the circadian rhythm can wreak havoc with your metabolism. Also, keeping your bedroom dark, cool, and quiet will enhance your sleep quality. Also, limiting sleep in the time that also limiting screen time 1 or 2 hours before going to bed will improve your sleep quality. Being mindful of your eating and activity habits will directly affect your sleep. Avoiding late night meals to take the stress off your digestion and your circadian health. Also, engaging in moderate physical activity will cause you to be more tired and be able to fall asleep easier. Also helps with your metabolism. There's a lot of benefits in regular exercise programs, so don't forget exercise. Exercise improves sleep quality, reduces stress and anxiety, and decreases daytime sleepiness. Other things to be mindful of when you're trying to optimize your sleep. These include prioritizing your sleep, making sure you're getting 7 to 9 hours of good quality sleep, using stress reduction techniques such as journaling, meditation, and deep breathing, walking, taking hot showers to help improve your sleep quality. Avoiding caffeine, heavy meals close to bedtime will prevent sleep disruption. So in conclusion, quality of sleep is fundamental and is often overlooked pillar of successful weight loss program. Overall health, operating in a complex relationship between diet and exercise and your weight and your sleep. Insufficient or poor quality sleep significantly disrupts the body's hormonal balance, leading to increase in hunger hormone, ghrelin, and stress hormone cortisol, while decreasing your satiety signals from leptin and GLP-1s, which, by the way, are indigenous hormones like Ozempic that your body makes GLP-1s to control your appetite. By getting enough sleep, you are optimizing your GLP-1s that are naturally produced in your body. These hormonal changes drive individuals to consume more calories, higher carbohydrate meals, and high-fat food, and also craving less nutritious food, hindering weight loss effort. Furthermore, sleep deprivation reduces energy and motivation for physical activity. Inconsistent sleep pattern can desynchronize the body's natural 24-hour circadian rhythm, further contributing to weight gain and metabolic dysregulation. Research highlights that composite measure of sleep health, which includes not only the sleep duration, but also how much satisfaction you get from your sleep, how alert and energized you feel when you wake up from sleep. What is the timing? How much time actually you spend sleeping? These are all important part of sleep health rather than just the duration of it. The sleep health is a strong predictor of successful weight and fat loss than just individual sleep duration. Therefore, prioritizing adequate quality of sleep through consistent schedule and optimized environment, stress management is crucial as managing diet and exercise. It's just as important to be on a good sleep regimen than being on a good diet, exercising, managing your stress. These are all related. We can't really separate them out. They're all intertwined. So in order to maximize your chances of being able to lose the weight successfully, you want to be mindful of all these factors. So with that in mind, I want to thank you again for paying attention and being part of this community. Please make comments if you have any questions, if you have any comments, and also there are handouts available for the shift. And I will see you next week. Keep up the good work.